class, when this is a part 2, we did part 1, which was kind of a little education on the different types of arthritis. We did that 2 weeks ago. And so I'm going to touch upon those things a little bit briefly for anybody who wasn't here, but I'm going to go through it kind of quick. And we're going to talk about the different types of treatment options, what's socially acceptable, what's true and what's really not true about the ways that we treat the different types of arthritis and degeneration in our body. Now, when I'm doing my classes, the classes are important to me because I'm trying to bring information to the public, right? That I feel is that we have beliefs, systems about certain things that are a certain way that aren't true. So what I will say will be controversial, but I will also back it up with truth and research and literature and things like that, okay? So I'm not going to tell you something that is generally accepted and not have evidence to back up what I'm trying to say, okay? So it's not like having a cup of tea with a friend or having a beer with a friend and you just talk something and they said something and then you believe it because your friend said it. You know what I mean? We have beliefs like that. That's where our brains work, is we hear something and oh yeah, dude, you heard, blah, 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 you know? Right? I saw it on the news, it was on, I Googled it. It's my favorite. We used to say you can't believe everything that's on TV. Now it's like you can't believe everything you read on the internet. But unfortunately, when you Google things, you get advertising. And advertising is not science. So, and it's hard to decipher the two because they've gotten very clever at how they market stuff to you. Okay? So when you come in with those things and then I have to go, no, that's not true. Then you say, yeah, but I saw it by the internet. I know, but I know. I know. So some of the things we're going to talk about might be difficult to hear. If you have questions like we do, you know, we're recording this, so if you don't necessarily have to share. You can speak with me after the class is over. I'll answer all your questions. Okay? All right. So treatment options. Now the title, let me go back to that. Knowing your options can save your life. Now you may say, well, come on, what saved my life? I mean, we're talking about arthritis. Yes. Yes. Okay? Quick review. This is what we talked about last time. There's 2, if not, we went over 3 different types. We broke it down, and I'll do it again. We have autoimmune diseases that attack the body. Those are a certain type of arthritis. We talk about rheumatoid arthritis, where the arthritis is that can come with psoriatic arthritis or lupus or other things where the white blood cell becomes very confused and starts attacking your own system because they're designed with little protein coatings on foreign bodies to say that's not part of our body. But bugs and bacteria and viruses are very intelligent, so they're starting to learn how to survive, and by doing that they figure out, hey, if I'm much like your body, you can't tell the difference. So the immune system gets confused, doesn't know what to attack, so even though they may have beat an infection, because the infection was similar to some of the cells in our body, the white blood cell starts to attack our own body. That's our belief system at this point. As much as we can tell about this stuff, we're still trying to learn more about autoimmune diseases and where they come from and how they occur. Is it the bugs or is it the treatment? We have to ask those questions when we go further into today. How many things are causing issues from the actual infection or disease? There are some studies that say, hey, because they took a mega dose of antibiotics or some type of interferon or things like that, that's what actually confused the immune system to actually then attack the body. So we're not 100% clear as to, is it the medication that actually caused the reaction, because we use such strong doses in some cases now to fight some of these infections, or is it really just the cells? So we don't know. There's a lot more questions than answers when it comes to autoimmune diseases. And then the big thing, which we typically do, which we'll talk about, is when you have an autoimmune disease, is to do something to suppress your immune system to try and treat the disease. When you suppress your immune system, you open up a whole nother can of worms, because that's your body's defense mechanism to help fight off infections, to kill cancer cells in our body and things like that. So you become more prone to those types of conditions. So when we talk about degenerative type of arthritis, the 2 big questions was, Is it because we move too much that the joint breaks down, or is it because we move too little? And we discussed and clarified that it's the too little movement that actually progresses the degenerative type of arthritis. It starts out as an injury or a malfunction in the joint, and then the body locks it down to protect itself. When it locks it down, it doesn't get blood, doesn't get nutrients, and it can't repair. And when it can't repair, it breaks down faster and faster and faster. So, and the example that I'll always give is that we look at surgery for as simple as knee surgery, showing your scars here before we got started. But with simple knee surgery 20 years ago was you came out, you were in a cast. You wore the cast for months. You were in a brace for months after the cast. You did physical therapy for probably a year, if not two, after, just to be able to walk without a cane 2 or 3 years after knee surgery. It's not like that anymore. Now you have knee surgery, you're out. Before you even wake up, you're hooked up to a machine that moves your leg. Because we realize movement is what the joints need to heal and repair. They have to have movement to heal and repair. The less we move as human beings, in general, the more problems we're having with all of our health conditions. That's why I do that sitting is the new smoking class, and I would contend from the research that I've been reading over the last 2 years, probably have to change the name because it's actually worse than smoking. The more we sit and the less we move, the faster all of our diseases progress. We have to have motion in order for our bodies to be healthy. And for all of us, that means something different. Maybe all I can do is walk to the mailbox right now and back. Maybe that's your exercise for the day, but you do it every day. Because pretty soon you're going to be able to go past the mailbox to the corner, right? And then pretty soon you're going to be able to go around the block. Your body's going to keep increasing its ability to move if you keep moving it. The same thing happens if you stop moving. The less you move, the harder it is to get up and get moving. Have we all experienced that at some point? Yes? Right? We have to have motion in order to be healthy. So it is a disease of too little movement in the joints that progresses and speeds up the degeneration. If they move, they get blood supply, they get nutrients to joints. If they don't move, no blood supply, no nutrients, they break down faster and faster. Joint damage from prolonged malfunction, we talk about the subluxation. Last time, the bone out of place, which is what as chiropractors we're taking care of you for, is to try and get that bone back to its normal alignment the best that we can. If the joints are severely degenerated and broken down, a lot of times we can't get it all the way back, but we can help to get some motion back into the joints. We have patients with horrible degenerative arthritic spines that can't hardly bend and walk and move. And I have somebody with the same x-ray who's out cutting their grass, mowing their lawn, doing other exercises, playing tennis, golfing, walking, boating, fishing, doing everything that they want to do in their life. The same degeneration. It's not the degeneration that's the issue, it's the movement. Does that make sense?
Yes.
Okay, so that's most of what we covered last time. We mentioned the subluxation degeneration. We've got to remove or reduce the subluxation the best we can based on the amount of degeneration. This is just an x-ray, and I bring this up because we have to talk about this. If you look at the top, this is the neck, looking at it from the side, you can see the bottom of the jaw. These joints up here, the top couple, we have healthy disc spaces, nice lines to the ends of the bone that are nice and smooth. When we get to the lower part of this person's neck, we have bone spurs. The body has added all this extra bone growth out into the front. Huge points that grow out. Sometimes they even grow back into the hole where the nerve comes out in the back. That's bad. But the discs, you can see, are compressed. The disc height is gone. Here's the big mistake. Somebody will have the impression that this person has arthritis because they're 65. That is the biggest mistake in belief, like we talked about earlier, in thinking. These joints here are the exact same age as these joints here. These are both 65-year-old joints. You don't have normal arthritis. There's no such thing. Arthritis is incredibly common. because we have never really learned to take care of our spines properly. But it's not because it's an age-related disease. In fact, because we are not moving very much anymore, my patients in their 30s and 40s have much worse arthritic and degenerative changes in their spine than my patients in their 80s and 90s.
Oh my gosh.
Because we live differently. 80 and 90-year-olds lived a different life than our 30, 40, and 50-year-olds are living. Far worse is my fear. I have, just yesterday, gone over an x-ray with a patient that at 15 is starting to show degeneration in the person's neck. 15.
That's terrible.
Our lives are changing. Our kids don't move. They sit in front of computers, they sit on their phones,
That's my
their
grandson.
heads are down like this,
That's my grandson.
reversing their cervical curve. They're showing signs of degeneration at 15 years old.
Wow. That's my grandson.
This is not an old person disease. You don't get arthritis because you're 65. What was the difference? 80, 90-year-olds, 60, 70 years ago, nobody sat around in front of a TV. Nobody sat around playing video games. Nobody, I mean, you could barely afford a book. Everybody was outside running around and playing. We walked to the store. We didn't drive every single place we went. We moved. The human body has all these joints and muscle tissue because it's supposed to move, not sit in a chair in front of a computer until your brain is so tired at the end of your workday that you go home and sit in front of your TV and veg out for a couple more hours and then go to bed.
That's my grandson.
This is the life, but it's horrible. The diseases that we're seeing are all on the rise that have anything to do with inflammation. People don't get sick from infections much anymore because science has gotten so good at help fighting infection. Does it happen? Yes, but not to the level that it happened 70 years ago. Now everybody's getting sick from inflammatory diseases like arthritis, like cardiovascular diseases, like Alzheimer's, diabetes type 2. All these types of diseases are just our bodies just breaking down and breaking down and breaking down. And we take another pill to pretend we can't feel it while it continues to break down, and we don't do anything to change our bodies. You with me?
Right.
We have to do something to change how the body's functioning. Medicine doesn't do that. It blocks the brain's ability to know it's sick. That's it. The insulin that you take when you're type 2 diabetic will never cure you of diabetes. It's only just to get you through the next few hours so you need another shot. Does that make sense?
Yeah, but if you didn't take it.
I understand. But if you
Go
don't do
into
anything about it, it's estimated that 87 to 93% of every type 2 diabetic would not have type 2 diabetes if they exercise and change their lifestyle and ate differently. You can get rid of it.
You can?
You can reverse it, but nobody's willing to do the work because it's so much easier to take the insulin. If the doctor says to you, you have a high blood pressure, let me give you the high blood pressure medicine, brings your blood pressure down. Is it important? Yes. You don't want to have a stroke? Okay, I get that. But what are you going to do in the meantime to reverse the changes that are happening to your body if it's being controlled by the medication? Are you going to change your diet and are you going to exercise? I don't know. Or are you just going to take the pill for the rest of your life? So we're in this culture, we have this belief system that I can just take a pill and I'm going to be okay. No, you take a pill and you don't really feel the disease, but the disease is still happening on the inside. So we have to physically do something to change our bodies to get healthier. Does that make sense?
Yes.
Okay. So, back onto degeneration and arthritis, if you will. So, basic medication reviews. So there's a couple of different drug categories. The most common drug category for the treatment is what we call NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. Non-steroidal, that's what it stands for, NSAIDs. So NSAIDs are a lot of the over-the-counter medications that a lot of us take, like aspirin, Tylenol, Advil, Motrin, ibuprofen, naproxen, I can keep going. You have all the different Aleve, the different trade names. A lot of, like the Advil, Motrin, ibuprofen are basically the same medicine. They just different names, different companies, trademarks, etc. It's estimated that Tylenol is in over like 500 different medications now. So it's a compound placed in a lot of other different medicines too. So sometimes it's not just that. There are issues with Tylenol, and they're in overdosing with Tylenol because not everybody realizes they're taking a medicine that has Tylenol in it, and then they take Tylenol for something else, and they can damage the liver pretty bad. So some countries, I believe New Zealand, if I'm not mistaken, has actually completely banned Tylenol and Tylenol products altogether because of the side effects and problems with it. So prescription medications like Celebrex, these are the stronger ones. These are a type 1, these are type 2, and how they are COX-1 and COX-2 is more complicated, you know. But these are Celebrex, Feldene, Toradol, Mobic, Ultram, Relafin, more the prescription. These are a little bit stronger doses, have a similar pattern in how the body utilizes them. The issue that we face is, oh, and then there's steroids. Before that, I'll go back to the issue in a second. So then we have non-steroidal, and then we have steroidal, right? And that's the cortisone shots that you can get, or prednisone pills that you can take in packs. These are very hard on the body, so we typically only allow it to be in your body for maybe 5 days or 10 days or something like that, to try and reduce the inflammation, because they have a lot of side effects. There's painkillers. Some people have to resort to that because the arthritis is so bad. And we have our morphine-based, we have our opioids, codeines, OxyContin, Percocets, all those type of things. I think everybody is aware of all the issue we have with the opioid crisis. It's in the news now. We talk about it all the time. The people had started out with addiction with this, to become addicted to these medications, and then go down a bad path. The doctor says, well, I'm going to take you away, but now they're addicted to it. The most easiest accessible thing for people to take is heroin. It's just very available anymore, and we have heroin. I mean, the overdoses of heroin issues are unbelievable. Some states are losing, I think West Virginia, Ohio are losing like 14, 15, 16 people a day
That's true.
that are ODing, and that's just the ones that they couldn't save. There's a whole bunch more that are ODing, and they're saving and getting back out, and you know. So it's a major issues, and unfortunately, a lot of it started with a doctor prescribing a painkiller to help them relieve their pain that they became addicted to. The issue we're facing now is that we're pulling these things back. Now, but you can't just go to somebody who's addicted to something and say, okay, I can't prescribe that anymore. There's got to be a whole treatment plan that ensues to wean them off of a medication or change their medication. That's not being fully enforced yet. One of the cool things that just happened in the state of West Virginia is they're making mandatory 20 visits. Is it 20 or 24, Doc? Do you remember? I can't remember. I think it's 20 visits that you have to see a chiropractor before you can get a prescription.
Good.
So let's see if we can try and do something naturally before you get the prescription in the first place.
The AMA is making that mandatory?
No, the state of West Virginia just passed a bill, I think it's about 3 months ago, that's making it mandatory that you see a chiropractor before you can get the prescription.
That must help the chiropractors in West Virginia.
Yeah, it's good. It's good to be a chiropractor in West Virginia right now. But you want, or truthfully, you want people there for the right reasons too.
Yeah.
And not just because I'm coming for 20 visits so I can go get my pills. It's more the opportunity to try and educate and change a lifestyle and pattern and decision making and everything that goes with it. So immunosuppressant medications we just talked about, there's a risk that comes with those, cancer, infection. I do have a patient that's just killing me. We found out that they are in stage 4 cancer. They've been on the medications for 2 years. It's horrible. So they did have relief from their pain from the arthritis from the medication for 2 years, but having their immune system suppressed allowed cancer to spread through their whole body. So side effects, as we started talking about it. So some of the things that we see is increases when we're taking anti-inflammatory medication. I'm going to explain why in a little bit, but increases in heart attacks, strokes. Anybody remember Vioxx? So Vioxx came out, oh boy, it's gotta be over 10 years ago now.
Yeah.
And within like 2 years, there was over 50,000 people that had a huge spike in the numbers of people who had heart attacks and strokes. And everybody went in and they were like, no, we gotta pull this drug back. So that opened our eyes to the fact that what a role an anti-inflammatory can play in the system. It does happen on a much lower level with all these other drugs too, but just not as intense as was happening with Vioxx. And of course, I think it was Merck that got in trouble, quite a bit of trouble for knowing before they even released it that it was that dangerous. But they, paid a couple $100 million out and come out with a new one. So, so we have that, kidney, liver disease. Tylenol is harder on the liver, the ibuprofens are harder on the kidneys and your digestive system. I'll explain why in a minute. Increases chances of infections and cancer, that's with the other medicines that are immunosuppressant. One of the leading causes of hospital visits in the United States is from over-the-counter anti-inflammatory medicines. It's one of the leading causes, one of the main reasons people go to the hospital in the US. It's for medicine. Think about it. Over 40,000, or estimated around 40,000, it fluctuates a little over, a little under 38,000 is probably more of an average, a high 38,000 and change a year die from taking over-the-counter medicines because they bleed to death internally. There are no symptoms whatsoever when you're bleeding to death internally other than you faint, and that's it, and you don't wake up. Hopefully the doctors can find the bleed in time. The intestinal tract is very long. The bleed hole could be very small, very difficult to find. You have no symptoms at all. You have no symptoms at all if your kidney is failing until you're at 95% failure. You only have 5% function left. You have no signs of liver malfunction until the liver is down to about 90% of function. You can't wait till you know something's wrong from taking the medicine. You have to find other ways before that happens. Do you understand why I named it Knowing the Right Thing Can Save Your Life? Making the right decision, yes? These medicines and the way we're treating this condition and then not doing the right thing to help the body repair is a huge mistake. It's estimated that almost 80% of everybody in the United States is going to have a back problem at some point, especially the way we live right now. Medicine is not the answer. It doesn't fix anything. It'll slow your symptoms down, but the actual degeneration in the joint speeds up when you take anti-inflammatory medications. Your arthritis grows even faster while you're taking that medication. The reason being is that inflammation in our body is a natural part of the healing process for any injury, no matter what it is. It's normal to have inflammation. When you force the body not to have inflammation, all the cells inside can't repair properly when they're damaged. And in your stomach, for example, it's constantly dying off cells to help release hydrochloric acid so you can digest food and making a new cell. If you mess with that process and the stomach can't repair itself because you're taking anti-inflammatory medicines, it starts to wear down the lining of the stomach. And you get ulcers and all this type of things can occur until it eventually breaks a hole right through. Does that make sense? The kidney is constantly making new cells. That's why the kidney is so sensitive to these medications. Because the kidney can't repair itself the way it's designed to do because we've forced it not to go through the normal inflammatory process and repair. The liver, the same thing. The places where the cells have to constantly be made new all the time are the ones that get damaged by anti-inflammatory medications. Does that make sense? You understand why it's so, how they damage the other tissues now? So, what are our options? Number one, prevention, of course, is the best. So, it's so much easier to be a kid and go out and play than lay down and play video games until you have arthritis at 15. Yes? And then try and reverse that process. It's so much easier to eat healthy and not get type 2 diabetes than it is to try and reverse type 2 diabetes. It's so much easier to eat healthy and exercise and decrease your chances of having cardiovascular disease than it is to try and heal and recover and get back on your feet after a heart attack if you survive it. Does that make sense? Mm-hmm. But that's the way we think. On our culture is, I'm going to eat what I want, drink what I want, not exercise, I'm going to do everything I want to do and everything I feel like, and then when I'm sick, then I'll change my mind and start trying to do healthy things. A lot of times that's too late. And I joke, but I say, everybody wants to eat a salad after they have a heart attack. Nobody wants to eat a salad before. Not that the salad cures heart attack, but you know what I'm saying? Like, we all want to do healthy things when we're put to the test and the gun's at our head, and this is it, it's do or die, but not all the time before then. This is the education that needs to go to our kids. The kids need to learn this stuff. They need to know how important exercise is. It's not just fun and games, it is, but it's about their health. They gotta move. As 30-year-olds, we gotta move. We can't be stuck in a cubicle. As 50, 60, 70-year-olds, our arthritis hurts because we didn't move enough when we were younger, or maybe we got an injury, but we gotta get up and move anyway. Does it hurt to go to the gym some days, Bill? Yeah.
There every day.
But where you are now compared to where you were 5 years ago, you're a different person. You're getting up, you're going and working out and moving, and you can do things you couldn't do.
4 years ago, I had a 5% chance of living after 4 years. Now it's been 6 years. I'm getting ready, going through chemo right now. And Tuesday, hopefully I'm gonna ring the bell.
Gonna go work out. So you move anyway. Yes? Does that make sense?
Yes. I'm always moving.
You gotta keep moving. You gotta keep moving if you wanna keep moving. Don't tell me you can't move. Everybody can move. That's your finger. We'll start there. Nutritional, as long as it's not changing the clicker on the mouse, that's not, we got it that. Nutritional supplements can be added to reduce inflammation. Now I say this because nutritional supplements, what is happening is a lot of the foods that we eat, especially sugar and things like that, are very inflammatory, which causes anything you eat that's a sugary substance will cause more inflammation, whether it's heart disease or allergies or asthma or irritable bowel syndrome or colitis or if it's arthritis, the inflammation in your joints. More inflammation. We have to be very careful about how much sugar we're putting in our bodies. We have to cut back our sugars. There's so much sugar hidden in foods in different ways under funky little names that you might not even look at something and realize it's sugar, because there could be 10 different chemical compounds that are actually sugar, and you don't realize that it says sugar 10 times and there's no food once, right? So you have to be very careful when you even look at labels of things anymore. So sugar is probably our biggest inflammatory. So knowing some of that's out there, knowing some of that's in the foods, I'm going to talk to you about some supplements and some nutritional things that you can do that are really helpful. The difference is that what I'm going to talk to you about breaks down completely differently in your body, so it does not damage the organs and tissues and cells. It actually supports them, because it's a whole different and way too complicated. It's hard for me how complicated it is. I'm not going to teach you the complicated process. You can trust me, and I can actually give you reference to exactly how it is, but I'm not going to go through it tonight, okay? It's different. So it's actually healthier. So things like fish oil, one of my favorites. This is really big right now. You know what? You can eat fish too. That's really good. Some fish have more oils in it than others. Usually the ones that have a fishier flavor have more of the omegas in them than the ones that don't. Boswellia is great for joint inflammation. Curcumin is what is the powerful product in turmeric that helps reduce inflammation. I am reading so much research on turmeric that it's just off the hook how great it is for your body. If you don't add it to your food from a natural herbal thing that you don't like the flavor of it or something, a supplement's fantastic. We're seeing Capsaicin, which is more of the hot spicy stuff, can help reduce inflammation. Bromelain, which we find in things like pineapple. Ginger, everybody knows that, but ginger ale has so much sugar in it that the healthy part of ginger is lost in the sugar in the ginger ale. Evening primrose oil and black currants, or GLAs are what they're called. They're more fatty type compounds that are much similar to the omegas that help with joint repair and reducing joint inflammation. What we're starting to see as we're starting to understand these herbals and supplements and nutritional things, we're starting to understand them a little better. There's companies that are mixing, so there might be 2 or 3 or 4 of these things in a compound nowadays. That people are taking some of the supplements. I have seen great things from patients who, if they're in a tough boat to hoe, so to speak, road to hoe, these are good supplements to take that are going to make your body react a little bit different to inflammation. But key thing is really our food. You got to really be careful how much sugar you put in, period. Okay? You can't stress that enough. Vitamin D3, I do a class on D3 every year. It's critical. By far, the one thing that we are low on of all of our vitamins. It plays a role in cancer development in the body when you're low. It's incredible the numbers and difference between what low is, and now they've created a low normal. So it's like, it used to be 50 to 70 is normal, which it still is. 50 to 70 is normal. Anything below that is low, but they created a low normal now between 30 and 50. But research also tells us really anything under 40, and the difference between somebody between 30 and 40 and 40 and 50, for example, there's a study done on women with breast cancer, and the number of people with breast cancer, when you dip below 40, the numbers shoot through. It's like 6 times more likely to get breast cancer if you're in the 30 range as opposed to the 40 range, and that's not even in the 50 range, so get into 50s where you belong. You should be getting every blood test you get, your doctor should be testing your D3 level. Anybody who works inside needs to have it done. But unless you're outside almost every day getting some sun exposure, not caked in sunscreen, blocking the UV rays from helping you make D3, it's critical that you watch it, monitor it. The D3 I have up front is the best that I have found at changing that blood test. I have not seen it, I've seen it outdo every time the prescription 50,000 level of D2 that the doctors prescribe for you. D2 does not raise your D3 levels. It's not the same thing in the body, and the body knows the difference. More questions if we have it? Okay. And bottom line, motion. So we talk about healthy types of exercise, underline healthy there, because what's healthy for each one of you is going to probably be different. So healthy forms of exercise have to be different things for different people. Some of us need strengthening, some of us need stretching, some of us need a yoga, some of us need Pilates, some of us need more cardiovascular, some of us need no cardiovascular. So it's like maybe, and like I said, sometimes it's just a walk to the mailbox, but you got to start somewhere. Okay? So things like heat can help certain types of arthritis, and ice works better with some types of arthritis. We have muscle stim that doctors will put on you to help stimulate the joints and tissues. But ultimately, one of my cool new things is the cold laser that we have, and it's helping repair with knees and joints. And we've been working with a couple of patients with diabetic neuropathy, and they're seeing some changes with that too. So it's a really cool new tool that is not an invasive, surgical, high side effect type of thing. It's just light, getting deeper into the body and stimulating your cells to heal at a much faster rate. Of course, I can't do a class without talking about chiropractic, and I spent some time explaining that earlier, so I won't go into it in too much detail right now, but other than we've got to get the joints moving. Got to get the joints moving, period. Okay? You get to choose. I will finish with a story. When I first started doing classes 25 years ago for my patients, I remember the first one I did, I was terrified standing up in front of a group of people. I was like a high school kid. I remember having to do a report, and I was nervous as can be. As you may notice, I'm not really nervous anymore, right? So when I do classes, we just did one for Dominion Power last year. There was over 300 people in the room when I did it. When we do classes for groups of chiropractors and I'm teaching them at that level, there's hundreds of chiropractors in the room when we teach our classes. So this is easy. But it comes down, I remember the first time I heard this story and I told this story, and I related back to this. There was a garbage crisis in New York some 20, 30 years ago. All the garbage men went on strike. Everybody threw their garbage on the street. It started to stink a little bit, especially in the hot summer in New York City. Also, the garbage began to get infested with rats. So imagine you're in your business suit, walking down New York City, going to work, right? You're all fancy, think you're doing something, oh, yeah, I'm going, and there's rats running all over the place, and you're hopping over them, and trying, right? And the garbage is stinking, and, right, this was New York. So the mayor of New York made a decision at the time. He says, what we're gonna do is, we're gonna put poison out and kill all the rats. Because everybody was complaining about the rat infestation. So this is where I started, I love this story. So they go in, so what happens when all the rats started eating the poison? Do you think the smell of the garbage got better or worse? That,
Get dead rats.
yeah. Now you got dead rats mixed in with the garbage. So, and now you got dead rats all over the streets. So when they did this and did the let's kill the rats idea, did they treat the symptom of the condition or the cause of the problem? They treated the symptom. They killed the rats. The garbage was still there. Does that make sense?
Even that's a symptom though.
Huh?
Even the garbage is a symptom. They need to settle the disagreement with the,
yeah. They did.
Yeah.
They won. The garbage men did just fine. But look, getting rid of the symptom doesn't get rid of the garbage. Does that make sense?
Right.
Killing the rats is not gonna solve your problem. The garbage is still there. Unless you're gonna do something to change how your body functions on the inside, all you're doing is stopping the symptom. You've gotta physically do the work. And that's what too many people don't wanna do, because it's so easy to take a pill and pretend I'm okay, even though you're still sick while you take the medicine. It is the biggest misbelief that we have in our culture today. And it can save your life if you get it and change it. And if you continue believing that I'm gonna take this pill and it's saving my life, you're sadly mistaken. Does that make sense?
Yeah.
Excellent. Thank you all for coming out tonight. I had a lot of fun.
Thank you for watching our video. If you like what you saw, be sure to subscribe to our channel.
Yeah, and like us on Facebook. There's always a lot of information also on our website at rosemontchiropractic.com.